Black Excellent Time. You know the business, soulmates. Welcome back to FOXSOUL's Black Report. There's a new magazine composed by Black healthcare professionals to inform our community about the medical advice that we need the most.
Yeah, the Black woman at the head of it is Michelle Green Rhodes, and she wants to make sure we are all familiar with the color of wellness.
COVID-19 was life-changing for so many. For Michelle Green Rhodes, it was an opportunity to use her skills and background for a greater cause.
I pivoted that love for writing into something more useful. I wanted something bigger because during the pandemic we saw massive amount of people dying.
Especially among African Americans who died at higher rates than other groups. A CDC report noted access to health care as one of the risk factors, something she saw firsthand during her more than 25 years working as a nurse.
I was an insurance nurse, so I saw end stage this, stage 4 that, chronic disease this, in most times African Americans. So I wanted something that could help.
That's how The Color of Wellness came to life. It's an African American focused health, wellness, and lifestyle magazine.
We're proud to say we're the first Black wellness magazine by Black nurses.
And Black nurses from across the country contribute articles each year.
All of our articles are evidence-based. We make sure that the nurses cite at least 2 sources so that we can say it's reliable, it's trusted, and you can check it.
She says building that trust and being able to relate to the readers is key.
We've been a bridge to healthcare systems because of that trust factor. So they've come to us to say, can you share this message with your audience?
That can include information about screenings, addressing mental health, and even sharing healthier recipes.
You know, I've tried this particular smoothie, or first time I tried mushrooms, like things we were seeing that people were incorporating into their lifestyles for the first time, which shocked me.
But something that let her know she's on the right track.
So I can't tell you a word that describes that feeling, to say all of those years you put into helping people get chronic care, now you could be extending a life.
Very cool. We were talking, towards the top of the show about the lack of trust with the Black community and medicine, and maybe, advocates like this, folks like this could be, a vessel, publications like this can be that vessel or that voice to come back to the Black community and say, hey, we've talked to these folks and this is good. You can trust this. I like that aspect of this effort here.
Hats off to Michelle for just the work that she's doing in addressing such a critical need within our community. And I just love that, to see folks from within helping and serving and bridging the gap and meeting the needs that we have within our community. It's just that grassroots sort of work, if you will.
And then personally, for her to just redirect her life and for it to be a complete life of service and giving of yourself, and she followed this calling and what I like to call now a ministry. That's something to be said as well, because sometimes we are redirected, and if you don't have like this selfless kind of an attitude or nature about you or disposition about you, sometimes you miss out on that calling because it's all about me, and what I want to do. So just a selfless effort to say, hey, this is what I want to do, and I want to help our people better our situation with the medical field. So hats off to her. Black excellence.
The beautiful thing about that is so many people are going to benefit from the work that she is doing. So may her tribe increase, may she get all of the funding that she needs.
And press and media coverage and so on and so forth. Absolutely.